Hello, welcome back. My name's Zoe. I'm the owner of Vet Physio here at Fit Pet Physio, and currently we are rehabbing my own dog Jack because he ruptured his cruciate back in April. And this video, we're going to look at what to expect from the first 2 weeks after surgery. So, week 1, there is already a video on this, so I will link that down below. I don't know how to link it in the video, that is too technologically advanced for me, but I will link it down below in the description for you if you want to have a good look at how we got on with Jack's surgery day and his first week post-surgery. But in this video, we'll do a quick recap of the first week, and then we're going to have a look at how he got on over the second week. So we started off the first week, obviously, at the vets for his surgery. It all went really well. We were really happy with how he got on. We got him home, we got settled, and we immediately started the next day, so 1 day post-surgery, with his rehab. So we started with the pulse mag on the acute setting, and we carried on with this throughout his whole recovery. We did the acute setting for the first 5 days, and then we moved to the chronic pain setting to help with his pain relief. For the first 5 days, we also did ice to try and reduce any swelling, also reduces pain because when you get swelling, you also get pain. And we also did some massage for the first 4 or 5 days, and then we sort of extended that until the swelling had reduced. As the wound started to heal, it was a little bit easier for him to move his leg a bit more, and the swelling did then reduce quite quickly. But for the first 5 days, the swelling was quite significant, so we did some massage. On his 3rd day post-surgery, we went back to the vets for a little check-up, check of his wound. They were really happy with him. We had some fun trying out different cones, but eventually we settled on the plastic cone with the soft cone over the top. Again, if you watch back the first week video, you'll see just how much fun we had with that, but I won't go into too much detail with it now. You can also see how he progressed with his walking. So he was still on toilet walks, just in the garden for the first 2 weeks. You can see the first day after surgery, he wasn't putting the leg down really at all. And when he was putting it down, even stood, it was knuckled over. And then you can see that by the end of the first week, he was starting to put weight on that leg, the swelling had reduced, and he was walking on it a lot more happily. So you've already had a little peek into week 2. If you've already seen the video in which Jack got his stitches out, because that was on day 14, so at the end of week 2. Again, I'll link it down below for you so that you can take a look back at those videos if you've not seen them yet. But let's have a look at the other things we did on the second week post-surgery. So we ended up making him a bit of a different bed. We gave him a few more layers, and now that his wound was healing a bit better, and the stitches were still in, but it was fully scabbed over, so I wasn't so worried about him getting anything in it. So we gave him a couple more blankets so that he could make himself a little bit more of a bed, because he was getting a little bit cold. And you can see he was a lot happier with his extra layers. He liked to have the extra layers, although still not happy that he had his cones on. We started doing some more weight shifting exercises. We were still doing his passive range of motion. We started that just after surgery when we started his massage, but we added in some weight shifting exercises as well, specifically for those back legs to try and get him to load the back left leg a little bit better. As you can see, he was standing better when he was eating. He was bringing the left leg more underneath him. It's not knuckled over anymore, and he's quite happily stood there. Same with when he was drinking. We put his water just outside his cage so he didn't knock it over with his cones. So every time he got out, he would be able to get a drink. And you can see he's standing a lot happier there than he was the first week after. In his walking, you can see that he's getting a lot more confident. He's getting a little bit more giddy, a bit more himself. You can see obviously throughout this week how he gets more confident with his walking. He's starting to try and pull a little bit on the lead. You can see that he's having some more time to sniff, which he wasn't really bothered with the first week after surgery, but into the second week he was trying to sniff a lot more. He was much happier stood out in the garden, looking around, and you can see that although the left hind is still turned out slightly and is placed like laterally to the side of him rather than under his hip, he's got a lot more weight now on that left foot. So unfortunately, sometimes I do get a little bit too giddy. You can see that I'm having to try and slow him down here. But in general, it was nice to see because he was obviously a lot happier in himself. You can see that he was starting to stretch a little bit more. So every time we took him out, he was having more stretching time. So he's obviously feeling a bit better. And you can see that when he does stretch, he's putting a little bit more weight on just that left leg alone and not relying on the right leg always being carrying all of his weight. He was happier again towards the end of the week, and then on day 14 we went and we had his stitches removed, and you can watch that vlog as well. I'll link them all below for you. I don't want to repeat myself now.